Hey everybody, it's Jenn and Kanata, and I just wanted to do an update. Um, Wednesday, we had our first case confirmed in the Ottawa area, and that's including Kanata. By Thursday, we had another case, and by Friday, another couple more cases. By Friday afternoon, my husband's work, an employee of his kids were sick. And our Prime Minister's wife just got confirmed that she has coronavirus. This employee's kids go to school with her kids. So that whole school was the first one to kind of shut down and was canceled on Friday. Friday evening, all the schools in Ontario are shut down for 3 weeks. 1 week for March break, 2 more weeks after March break, and in case anybody was traveling, for March break. So now my husband is teleworking, and all of his team is teleworking, because we're about 4 levels away. So we don't need to get tested. We're kind of self-isolating as well as social distancing. So we don't really need to completely self-isolate, but we are doing that. If his employee takes the test and finds out he has coronavirus, then we move up a level on the whole pandemic level thing. But that employee was advised by the doctor that he wasn't going to get tested unless he started showing symptoms. His kids were suspected of having the coronavirus, and they got tested. So we wait to see if those ones come back or whatever, or that's my understanding. Anyways, we are good. We are fine. We are not going out to my in-laws for dinner. All the churches were canceled in the area that I know of. Our church got canceled, so that was good, as I wasn't going to go anyways, because it was just advised not to be in big, large groups of 250 people or more of the social distancing thing. So limiting exposure, limiting everything, we are fine. That's all I wanted to say. Hey everybody, I'm back, and I just wanted to share some more update. The news keeps on changing every hour of what should be done by everybody. Okay, we're going to self-isolate. That's fine. We have enough food. You've seen my pantries, you've seen my fridges and stuff like that. By the end of week 2, we will have not have gone to the grocery store for almost 4 weeks, because it is now Sunday the 15th. I did my groceries a week and a half ago. So, anyways, that's the update for us. It is not going to be too much of an issue. I do have a couple of friends that have said that they could do a food drop if we need it. Like, we might need sour cream or milk. I will see how that goes. But our whole city is starting to slowly shut down, hour by hour, hour by hour. Grocery stores are still going to be open, because they're just now refilling the craziness of people going to grocery stores. There's been lineups like an hour and a half before Costco. Costco ran out of toilet paper every single day this week in 5 minutes. Our local Costco, which is like a 5-minute drive from my house, today put limits on toilet paper to 1 or 2, so it lasted longer and it stops people from hoarding, right? Because they don't need it, okay? This is coming from somebody who always has one of Costco's toilet papers usually on hand, plus what's in all the bathrooms, okay? You don't need it, okay? If we all just continually just buy what we normally do, it will be fine. Stock up a little bit, buy 2 of something. You only need to buy stuff for like 2 weeks, okay? If you are actually in isolation, you're only isolated for 2 weeks from the time that you get like in contact, or 2 weeks from the time that actually it's 24 or 48 hours once all symptoms are done. And it usually takes about a week of getting sick. So even if it was 3 weeks, you should be fine. What I'm worried about is I have a lot of friends who work retail, work in the restaurants and stuff. They don't have the options to stay home. A lot of their employers are still expecting them to come home. A lot of the employers are still keeping the doors open. Or if they are sending them home, they are not paying for them to stay at home. Our government just released a plan for those who do not have the opportunity to go on EI right away, which still EI is 55% of your income. I don't know about you, but if I'm working a minimum wage job and I barely can pay the bills with that, having 55% of that is not going to help me much, right? So it's a good plan. It's good. It's a step. It's something, but I'm worried about also the clients that use Kanata food cupboard, right? Because if they are already struggling for food, they don't have a store of 2 weeks worth of food. We only give them about 5 days worth of food. Some things last longer, like the pasta and the potatoes and stuff like that. But honestly, like we can't. Maybe the food cupboard will give them an opportunity to go a second time, if they can, in the 30 days instead of one, or be more lenient for those who need it or whatever. I know we do sometimes emergency ones, but it's not necessarily like you not necessarily advertised or whatever. Because I mean, some people might take advantage, but it's very rarely actually used. So there is possibly that. But I think like the local churches and community centers and stuff also need to help out with that. Also, like I don't know about rent. Not for myself. We're paying the mortgage. My husband is getting teleworking, so his income is secure. We're good, so we are fine financially, as long as he can telework and get paid. We are fine, but it is just a scary thing out there. Like and it's still winter here. Like I'll show you the snow. It's still lots of snow here, right? So we can't start planting. You can't grow things. It's still cold, so we still need to also pay for heat. So we can't just turn it off to cut bills down. But I'm just worried about the after effects. I'm worried about March break. All the city camps have been canceled, but the publicly funded ones aren't. Some daycares have been closed, the ones attached to the schools and the city-run daycares have been closed, but individual home daycares aren't. But we also need those daycares open, too, for the people who need to go to work, like the doctors and nurses. There's very few instances where doctors and nurses have one of their partner is able to stay at home, because most times they're working. Like people in the medical field tend to date and marry other people in the medical field, so they're all needed. And even though we think about retail, grocery stores is also an essential service, right? Even though they're making minimum wage, they're still needed. The statistics of people who have minimum wage jobs also having another partner in minimum wage job is fairly high in our city. You usually depends. It's kind of 50-50. Like you either have somebody with a really high paid job and then somebody who's working part time to make extra bad money, or they might be working full time. The ones that are usually working full time in the grocery store are usually the single parents, and so they need the hours, they need the pay. But then also, if they get sick with people, the stores have been crazy. I've been seeing pictures of lineups all over the place. It's now slowly dying down today because I think everybody, all Thursday, Friday, Saturday, because all these things happen, boom, 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 telling the schools have an extra 2 weeks, closing down camps. Prime Minister Trudeau's wife confirmed to be having the coronavirus. What else was the other thing? Public service workers, like the city telling any the government employees, anybody that can work from home, to work at home, to contact their employers. My husband's work, the federal government has said most of the jobs that are available that can work from home are being able to work at home. And those who, the one thing that's nice with the federal government, if you are at home, and your daycare you're having issues getting alternate daycare, and your job you can't necessarily do a lot of it from work from home because you also have small children or whatever, like you don't have anybody to cover that. They are offering leave with pay because of the coronavirus, so that's good with the federal government. Okay, so that's a union thing. That is good. At least there is that, because I have also family members and friends who are also in the same position. They can't get, like, their daycare is closed. They can't go to work, but some of their work they could telework a bit. But if they have a 4-year-old, 7-year-old, 8-year-old running around the house, or all three, kids, you can't do a lot of work when you're supposed to be watching the kids, right? So they'll probably be able to clock in some teleworking time, but not necessarily during working hours. And there is that. So I'm just praying that the next 3 weeks just calms everything down. Whoever's going to get sick, gets sick, and hopefully not severe. Hopefully it's all mild, and then it can be over. We can be on the other end of things. Because if people just stop going out and stop going to Costco, like, you don't need to go to Costco, you can go to the regular store and just, stay for a little bit. I might have to cancel Abby's appointment on Friday. I'm going to call them earlier on this week and touch base. For the other people that are there, because when she gets the IV iron, she's with children who are on dialysis or getting cancer treatments or whatever. Those people need it a bit more than my daughter. They are more sicker, and I don't necessarily want to put their health in jeopardy or add to put my daughter's health in more jeopardy by catching whatever else is out there at the hospital on public transportation around, because people are stupid. People don't think that they're sick. And the problem with this virus is that you are contagious days before you even show symptoms. So you could not be sick and still be contagious. So, this is why self-distancing, social distancing, self-isolation and stuff is really, really needed. We need to do this. We need to and help our neighbors. If you check on your senior neighbors, check on your neighbors with a disability, check on your single parent neighbors and friends, just to see how they are, because honestly, they're the ones that are probably having major anxiety over things. They might not be prepared. Okay, they might not financially be able to have been prepared. I have friends who have, at the end of the month, they have $50-$60 to spend on groceries. So they might buy some in the beginning of the month with their first check, and at the end of the month they don't have much. And and so most months there's not a lot of carryover. There might be some, but not a lot. And those are my friends that I'm like, okay, if you need anything, let me know. I have food. I can lend you food. I can give you food. Not lend, you give it back to me. If you need toilet paper, I can lend you a couple of rolls of toilet paper. Not lend. I'll just give you a couple of rolls of toilet paper. If financially, I can't help too much, but, because I've already helped one friend with a good chunk of change, and so that my savings depleted, so I can't really help anybody else. But check on them, see if they need help. I mean, we'll be fine. It's a bit scary, but we'll be fine. I'm just hoping we don't actually get sick, because chance of getting sick, then it getting to me, no one's going to be taking care of me. Not very well. So we just pray that just be self-isolating and just stay home and be okay, and just continue to do everything that we were doing before. We did get some actual gravity water filters from Amazon. My husband was like, one thing we don't have is access to a lot of fresh water if we run out of water, and if somehow that gets shut down, right? So we have that. That's basically a life straw type thing. We got 2 of them with a hose and stuff like that. So we can access water from the river, which is just a short distance away. and filter it if we need to, or from rainwater or whatever, or ice or snow, melted snow. We got lots of that, right? So there is that. So that everything else, we have extra medical supplies, extra bandages, extra stuff for a couple months. Like, extra Tylenol, Advil, and stuff like that, because I just bought the things at Costco. So like 200 pills, I think, will last at least a couple months. Um, but I do have jugs of water downstairs. Not many, because they only last a while, and I usually replenish them in the summertime when the water goes on sale, and then I have them for another couple of years or whatever. So, but we have water, we're fine. We have electricity and stuff like that, so we are good for now. But I just wanted to kind of update. If you see stuff about Ottawa, Ontario, Canada in the news, that's where I live. Well, Kanata is in the west end suburb of it. So it's getting, like, the people here are getting kind of antsy and kind of crazy, going, like, worried about stuff. I don't know what they were prepared for before, but everybody's like all about washing hands and stuff. I'm like, what? Weren't you washing hands before? Weren't you wiping your butt before? There's all, like, why is there no toilet paper at Costco? The other grocery stores have had it, so now some have been limiting it. But one store was out of, like, canned vegetables and stuff like that. But they're getting a new shipment. All the stores in my area are getting truckloads every day or every second day. So you just have to figure out which store you're going to, and do you really, really, really need it. The fresh food is still being dropped off at the stores. We're still doing okay. I did order from Amazon some canned cat food for my cats. Like, we're coming down to about half a package. Just because my friend who works at a pet food store was just saying that where she was, that people were coming in and buying a whole bunch of it. Now it's gone on to the pet food, right? Now she works at more of an elite pet food store. My cats just like Costco dry food and 9 Lives. So not quite the same demographic of animals, but because they don't have necessarily any other health issues that need a specific diet. But this is what I did, and it got delivered today. I ordered it last night, got delivered today, and an emergency package, a small package off Amazon of kitty litter, in case when I do go to Costco in 2 weeks, that they run out of kitty litter, because I have one box. I want to make sure that my cat has what she needs, or he needs, because I have Peter as well, too, so. So just thought I'd do a little bit of update, let you know everything's fine. Keep us in your prayers and thoughts. Keep everybody in your prayers and thoughts. And all I can say is thank God we live in Canada, where we have healthcare, free healthcare, so that when we do get sick and we need to go to the hospital, we will go. We are not worried about the bills afterwards. We are not worried about the medications afterwards. We do have insurance to pay the medications, but some of the medications would be covered too if we didn't have insurance. So, because they always try and make sure that everything is covered. So we're good that way. But there are other people in other countries that aren't. We're catching it at the beginning. We are not waiting until it's gone crazy overboard, to the point of that's now thousands or whatever. I mean, in our city, we just got another few confirmed cases. We're now at 10. Okay, we were at like 1 on Thursday. It is now Sunday. In 5 days, we're at 10. So if this keeps on multiplying like it is, by next week we could be at 1,000. Who knows? But so far, every case that has been confirmed has been fairly mild, so there has not been major respiratory issues, which is good, other than the people who have respiratory issues because of other things, so not because of this one. So that's the good thing. Here are the water filters. The versatile design simplifies your life. Portable personal water filter. And it has a hose for gravity dripping. So, I want to touch base and say thanks for watching. Comment below what other things we should possibly do, and if you have any ideas and stuff. We've been keeping up our vitamin C content, drinking juice and taking our daily vitamins, just to be on the safe side. It's always when it's cold flu season that we remember to take our vitamins. The rest of the year we don't, unless we're sick. And then it's like, we should probably take them. But my brain is always too full of other stuff to remember that type of stuff. So, but comment below if there's other things that maybe we should put into our 72-hour pack, that we don't have. Some other ideas to think of, as it has made a difference, because the tornado we had 2 years ago made a huge difference. That my 72-hour pack was not up to snuff. It's better now, but again, we noticed, like, I've been slowly adding to things and making sure it was well stocked for our needs as of now, not our needs when the kids were small. So it is not that bad. My biggest thing is I'm going to get a container to actually hold everything, so I know where everything is all at once, versus I have it in various different spots. Then that way it keeps it all one place and we know where everything is. So thanks for watching, and have a great day. Stay safe, stay healthy, and let's just try and keep each other's in our prayers and thoughts, and look out for our neighbors, whether it's a neighbor next door, down the street, over at the next county. Check on your friends, family, neighbors, and see how everybody's doing. Just to touch base. You never know when you could be of help to somebody else. Bye, friends.